Hello, everyone. Good morning. So today we're going to talk about natural medicine for colds and flus. Hello to everyone in their home, washing the dishes or doing whatever you're doing while you're listening to this. Feel free to send me any questions that you have that come up, or if you really would love to attend a live workshop and you have a certain time or day that works the best for you, you're welcome to email me and I'll make it work to have at least one workshop at that time so you can come join us live. So today, these are questions that I get a lot. And so I sort of, have been doing the workshops based on what things I get the most calls about or the most questions about. And this is definitely one of them, especially this time of year. All the epidemiologists are saying that we're going to have a pretty severe flu season this year, but also colds as well. And that's partially because usually there's a certain amount of people who are immune to a cold or a flu that they got last year and, have a certain amount of immunity, but so many of us, because of masking and because of social distancing, didn't really get sick as much the last couple of years. And so we're kind of making up for lost time is the way I think about it. But also we don't really have any sort of herd immunity or personal immunity to these colds and flus at this time. So that's why, I don't know about you all, but I've just been seeing people who, have kids in school and literally multiple illnesses already since beginning of school less than a month ago. I know a few things have passed through our house. So really, of course, the first thing we always want to talk about forever and always is prevention. So a lot of things that we know about, that you're just familiar with, washing your hands, mask wearing is very, very good preventative. I used to wear a mask in my office, partially because I see a lot of people who are immunocompromised or going through chemotherapy. And I want to make sure it's a place where they can come knowing that they won't get sick there. But also because was really nice last year to not really be catching a whole lot of things, a whole lot of viruses. And so that's the other reason is because there's so many things going around right now. It's kind of nice to have that extra protection. So in terms of prevention, they've done studies about what things actually really, determine whether or not people, so they do these studies where they actually stick things up people's noses that have viral particles on them, and then they see who gets infected. The big things are getting enough sleep. That's one of the biggest indicators. So people who got 5 hours or less of sleep were actually 3 times as likely to catch the virus that got stuck up their nose than people who got 7 or more hours of sleep. So that's really significant. And also that counts for very transient sleep deprivation. So if we have 1 or 2 nights where we're not sleeping enough, it makes us a little bit more susceptible to colds and flus. This gets challenging around travel and also around swing shifts and things like that, where just there's not a whole lot of control over when we get to sleep and how much we get to sleep. And a lot of times too, those same sort of scenarios end up being higher exposure scenarios. So yeah, it's definitely a 1-2 combination. So the other thing is stress. There's been a strong correlation between level of stress, and this is more chronic stress seems to be actually more impactful than even acute stress. But there's on the handout here, I wrote about the way that high stress causes you to produce more cortisol, which kind of suppresses that initial response. So basically what happens is you have a viral particle, you're usually inhaling it through your nose or your throat. And generally a lot of times you have an immune response that happens pretty quickly right there, and it can kind of make the virus, neutralize the virus so that it doesn't actually come into your full system. And that's usually, if you've encountered that virus before, if you've had a vaccine to that virus, that's how that works, is that you get a pretty quick immune response so that virus doesn't have the chance to replicate and become a bigger infection. So that's the ideal scenario, is that we encounter something, we have an immune response right here, and then it's done. And if we have more cortisol in our system, a lot of times that initial immune response is suppressed, and so we can end up with a bigger infection because of that. There's also a lot of people who are talking about, well, we've these studies have shown that there is a correlation between stress and increased risk of illness. of catching out, especially these ones where they give you the swab that contains the viral particle. And also there's a lot of kind of conversation about what the mechanism there is there. So I wrote this mechanism about cortisol, and that's just one of the many sort of potential mechanisms that are out there. So washing your hands, of course, is really important, especially, that becomes more important for the more cold, flu, and gastroenteritis viruses. So they tend to travel on surfaces, and the more that we wash our hands, the more we avoid touching our face, the less likely we are to get infected. Definitely, these are the nutrients that are probably the most important part of, to support our immune system, are zinc, selenium, iron, copper, folic acid, vitamins A, B6, C, and E. I don't actually think of that as a totally exhaustive list. So basically it's like all the nutrients that are really important, all the micronutrients that are really important, in order to support our body in producing white blood cells and support those white blood cells in doing what they need to do in the body. And these, you can cover all these nutrients by eating just sort of what we've been talking about, that kind of wide variety of vegetables, nuts and seeds, whole grains, and beans, all will pretty well cover these things. Of those, I would say zinc is kind of towards the top of the list of things that I see, often people being deficient in zinc, and that is, really important for immune function. The two, foods that have the most zinc in them are pumpkin seeds and these are the plant-based ones, and beans. So those are great sources of zinc. Zinc is also found in like chicken and fish and meats and things like that too. So here's my controversial statement of the day, which is that there's actually very little evidence about this immune boosting supplements. So I will say two things in two different directions about that. One is that really, actually, we have a lot of evidence about these immune boosting supplements, maybe increasing white blood cell count, or, making things, sort of activating certain immune responses. And also there's very little studies showing about whether or not that, what the effect of that really is. And the things that even have some studies, there's other studies that contradict those findings. All of that, and then at the same time, I'm going to say that, for myself personally, as well as clinically, I do notice that when I'm taking these supplements, the duration of any illness is much shorter than the people around me, or even myself when I'm not taking those immune supplements. There are studies showing that things like zinc and elderberry can reduce the duration of an illness. And there's other ones that sort of contradict that. Zinc is actually pretty well established as something that can shorten the duration of a cold or virus. So there is all of that. And I think a lot of people don't really like to hear that, because when we're sick, we want to take something, feel better, and get on with our lives. Being sick is the pits. You have to cancel everything, and sometimes it's an economic hardship because of having to miss work and things like that. Sometimes it's a personal hardship of if you have something that you're really excited about, and also just really uncomfortable, and it feels awful to be sick. And so that's why we all kind of want to rush through illness, and also there's a certain aspect of it, especially viral illness, that it just sort of has its own duration, and there's not a whole lot we can do about that except for rest and get fluids and things like that. So, and by doing those things, we actually can make it a lot less severe. We can make it, we can kind of get through it more, without as much difficulty. But there is a certain level of acceptance of needing to accept that viruses are in the world, and as humans we get viruses, and we get sick, and we can't all be well all the time. But also it's really hard to be sick. So all of those things are true. So for treatment during illness, we want to think about, ways we can address, congestion, cough, fever, those kinds of things. But really foundationally, I just really want to underscore, the fact that rest and sleep. So resting and sleeping in those first 3 days of illness actually has been shown to decrease the duration of illness. which is kind of the hardest time to do it. It's like when you're first starting to feel sick and you're like, oh no, I can't cancel today. It can be a hard thing to really make that happen. It's also a great way to prevent spreading the illness is if you can, take a little bit of time for rest in those first 3 days. I found that people actually are a lot more, because since COVID, people are a lot more welcoming of people canceling because of illness or especially in social situations. I think, there's a lot to be said for the fact that it's important to be able to do that. So in terms of treating congestion, that's really, when we talk about congestion, that's really when you have a lot of mucus, in your everywhere, in your schnoz, in your ears, and sometimes people feel it in their throat, the postnasal drip. What's happening is your body is, making this mucus to try to clear your passages of, viral particles, but also some of that mucus is dead white blood cells that have been fighting any infection and then die and then come out. There is a common misunderstanding that when your snot is, yellow or white versus clear, that it means it's definitely a bacterial infection. That's actually not true. So that just means that there's dead white blood cells in there. Sinus infections, a lot of people want to have antibiotics when they feel that sinus congestion. And very often, actually, a lot of the studies say that we shouldn't give antibiotics until it's been 2 weeks or so. Usually a bacterial sinus infection is a secondary infection. So we get a virus, we get a lot of mucus, that grows the bacteria in our sinuses, and then we have a secondary bacterial infection that requires the antibiotics. Very often people sort of misattribute the resolution of their symptoms to the antibiotics because they usually get them around day 3 or 4, and then they say, oh, and then it starts to get better, and that's because often the course of a viral infection is usually about a week to 10 days. So there's a lot of people are like, a lot of people say that the antibiotic has always helped me with my sinus infections, so that's why I should get an antibiotic. And I just sort of it's a tricky one because very often the research and the sort of what we know about sinus infections doesn't really correlate with that. Similar thing with ear infections actually is that there are potential complications for ear infections, which is why they often get treated with antibiotics, but there's been studies showing that the antibiotics don't actually shorten the duration for the course of an ear infection. So yeah, there's that. So congestion, one of my first go-tos is really a neti pot or a sinus rinse. Sinus rinse are the ones that are like a squeeze bottle, and they're a little bit easier. I find them just to be a little bit less of a gymnastics. Neti pot, you have to be like this, and the sinus rinse, you can really kind of like squeeze it, and then it kind of comes up and it goes, kind of clears things out, and it goes out the other side. And usually you could really get a good amount of mucus out when you use a neti pot, especially if you have that really thick, where you feel it's so full, but it won't come out. The neti pot or the sinus rinse are very helpful for that. One thing I noticed is with specifically with COVID, a lot of times it's actually like almost more of like a swelling in the nasal passages. Like I can see it on exam, and also it's people like feel this fullness, but nothing really comes out. And so yeah, it seems like COVID actually like really does travel on the epithelial tissue, which is like the lining of everything. And so it's often a little bit different the way that the nasal congestion shows up. But that has changed throughout the different variants. So more so now people have a little bit more of like a wet nose kind of situation than they did with earlier variants. It was often very dry and kind of sometimes irritated or swollen. So N-acetylcysteine or guaifenesin are my, I spelled guaifenesin wrong on my handout. Oops. That's a hard one to spell. But those are really good for thinning the mucus. So they thin the mucus so that it can drain. So NAC is something I use a lot. N-acetylcysteine is also known as NAC or NAC, some people call it, especially when people have like an ear fullness or a vertigo that happens related to a cold or flu. So what that does is it drains the fluid out of your ears in order to once that fluid is out, those little stones that are in your ears that sort of get do a read about where you are in space and whether you've turned your head. If there's too much fluid, those little stones kind of move too easily, and then they kind of tell your brain that you have just spun around really fast instead of just turning your head like this. So they those stones are, so we want to get the fluid out so that the stones can kind of like sit a little bit lower on the little hairs and they don't kind of fly around as much. And that's what, NAC or guaifenesin will do, is just sort of drain your ears so that you don't have that vertigo issue. Also, it's really helpful sometimes to just massage right here and right here, kind of coming down from your ear in front of this muscle here. And that can help to release that eustachian tube as well. All of that and warm compresses as well can be very helpful for just sort of draining everything. So yeah, and I also use the NAC or the guaifenesin a lot for people who kind of tend towards sinus infections, because that keeps the mucus from building up so that it produces an environment that's really conducive to bacterial growth. So that really helps them, drain the sinuses so that they're less likely to develop a bacterial sinus infection. So the caution there is that those, can interact with medications. So just sort of will check in with me or your provider about that before you take anything. Especially if you're on medications. Horseradish is a great one. Just really clears your sinuses. It's really good. Adding to eggs or beans is a great way to get some of it in. I actually have a story about my sinuses never being as clear as they were this one time when I was in college and I went out with friends and we went to sushi, and I wanted I didn't want to tell anybody that it was my first time going to sushi because that seemed very uncool. And so I ordered a California roll and it came with guacamole on the side, or so I thought. And so of course I put like a pretty good dollop on the sushi that I was about to eat, and ate it. And whoa. So I was basically eating like a teaspoon of wasabi. And yeah, my sinuses have never been so clear ever. It was yeah, it was a little bit embarrassing. I was like sitting and there was like 3 people on both sides of me, and so I like had to be like, oh, can I get out? like my tears, or my whole everything was pretty much draining very, very effectively. So I don't actually recommend that, but adding a little bit of horseradish to different foods can actually really help you sort of like clear your sinuses. And if you tend towards sinus infections, that's a great thing to sort of do habitually even. So yeah, warm compresses over your ears or sinuses can really help with the draining. So, some people even put herbs like bitter herbs or carrot on their sinuses and then put a hot compress on, and that just sort of like helps it drain even more. But just the plain old warm compress does quite a lot for draining the sinuses and draining the ears and everything. There's this Dr. Chiara's wild cherry bark syrup, or the Honey Garden's wild cherry bark syrup. They're both my real go-tos for cough syrups, especially when there's like an irritating quality to it, or like, those are just great cough syrups. I have other cough syrups I use in very specific situations. There's like a ginger tussin that I use when it's more of like a cold, wet kind of cough, versus like, kind of that more like dry, irritated kind of cough. But there's a couple of little, and then there's like a cough elixir that I use sometimes. But these are kind of my overall go-tos, good thing to have on the shelf kind of situations. Do note that those two do interact with some medications. They contain some licorice, which can be tough with certain blood pressure medications. And it can other medications that are metabolized by the liver. We want to be careful with interactions there too. So yeah, so those definitely having those coughs. Also, the other to help with the congestion. I actually put the cough syrup in the congestion section. It should be in the cough section, but it also just pretty much when people start to get really congested, the best way to really treat a cough is almost to prevent it. So if you start to feel yourself getting congested, work on clearing that congestion, because the more you have congestion and it starts to irritate your lungs, you get that postnasal drip, the more likely you are to develop a cough. And once the cough develops, your lungs get irritated, they produce their own mucus. It kind of creates this whole sort of cycle. Also too, your lungs are reacting on their own. It's not all about postnasal drip, but very often like a major contributing factor is that postnasal drip. So definitely good to kind of be on it with the clearing of the congestion as soon as it shows up, so that so that you're less likely to have kind of a long-term or painful or difficult cough, because the coughs can be so rough in terms of keeping you awake at night and all of those things. So also too, I put on here these acupressure points. So these can be really, can give you some relief like pretty immediately, especially when you're having that kind of like painful sinus congestion. So there's one right here, just at the corner, like right where your eyebrow ends, right there. There's also one right here, just in this little fold of your nose right here. And then there's one right here, a little farther out, that's like under your cheekbone there. And you'll find them, they'll be tender, and it's okay if you're not, don't get them perfectly, but find the tender spot, and you can either do like a circular motion like this, or a up and down motion, or just like a press and hold is also fine. So those will give you, like, a lot of times people will feel just like an opening of their nasal passages, just doing those acupressure points as well. So the warming socks treatment, this one is, I always say this is a weird one, but it works. So, and that's how it survived for so many years, is because it works, because it's a very strange thing to do. Actually one time I did this, I had a friend who was getting married, and she was like super congested, and she's an anesthesiologist, and she's really kind of a little bit skeptical about natural medicine, and she sometimes, in different ways. And so I was like, okay, you want me to do my woo-woo stuff on you? And she was like amazed, because she woke up just like super congested. And then we did this, and she was totally clear. She had been developing some laryngitis, and it really cleared it up. The way that it works is, it's called the warming socks treatment. The way that it works is really to help, circulate the lymph and also the blood, to kind of move it away from the head, so that it sort of gives some relief to some of that congestion there. It's pretty magical. So what you do is you take some thin cotton socks. So ideally 100% cotton, and you put them in. If you can't get 100% cotton, it's okay, but it's ideally 100% cotton. And you put them in a bowl of ice water, and then you I usually put my feet in like the bathtub, and let the hot water run over them. Or you can also make like a little hot water basin and put your feet in there for a few minutes. Whatever you need to, however you can get your feet very warm and hot. I suppose you could wrap them in like a hot, like a hot compress, or a hot pad, heating pad as well. It's kind of, the water's nice because it really gets the whole surface of it gets your whole foot, hot. And of course, if you have any kind of like a nerve issue, or a reason that you can't feel the hot water on your feet, I don't recommend doing this, because you could easily burn yourself. And also you probably wouldn't have the proper effect, because your body wouldn't really read the cold and then have the response there. So then you dry off your feet, and you I usually wring out the socks first, and then dry off my feet, and then put the wet socks, the cold wet socks, on my feet. The cotton socks, you want to wring them out really well, so they shouldn't, they should be, just really as well wrung out as you can get them. And then you should put dry wool socks. Merino wool is totally fine. That's what a lot of wool socks are made from, merino wool these days. And again, if they have like a little bit of something that's not wool, that's totally fine. Some people even say you can use fleece socks. I've tried it. It didn't work quite as well, but in a pinch, you totally can use fleece socks if you have those, but you don't have wool socks. And then you leave the socks on for at least 20 minutes. Sometimes a lot of times you can just go to bed with them on. And what will happen is your feet will actually heat up. So they'll actually become warmer than they were before you put the cold socks on, because your body is, basically sending circulation and, actively warming them up. And very often it will relieve like headaches and congestion and that sort of like really stuffy feeling. So it's a great little tool to have around. It's fine to do it on kids. Yeah, it just works really well, and it's good old water and socks involved. So one less, sort of thing that's a pill or anything. So cough, thinking about cough, I did mention the cough syrup that we, about the Dr. Chera's wild cherry bark syrup, or the Honey Gardens wild cherry bark syrup. Both are really excellent. So the honey is actually, well, honey is in both of those formulas as well, but honey actually outperformed prescription cough suppressants in multiple studies. So that's an interesting thing. And it's also really easy to just sort of sip honey, and it's a lot easier to get kids to take, so you don't want to, under the age of, depends on who you ask, 2 or 3, you don't want, you don't give raw honey to kids under the age of 2 or 3. But for kids also, you can make them a little like hot water with honey, and that's a great thing for them to sip. I know it can be pretty tough to get kids to take cough, any kind of medicine sometimes, and honey usually is a little bit easier to sell. And also homeopathics. I use a lot of homeopathics for kids as well. We could do a class on that as well. It's just, little homeopathics that are good for colds and flus. And also a hot shower, humidifier. I mean, really, if you have that sinus congestion or, a cough, it's really nice to just let the hot water kind of hit you in the face, like right here, if you can, if that's comfortable for you. And that what that does is it helps to thin the mucus, and it helps to like make it easier to get out, both from your nose as well as your lungs. So what happens is a lot of times that mucus can get thick enough that it's like pretty hard to what they call expectorate, which is kind of like get it up and out. So really what we want to do is help our bodies do that as much as possible, like by drinking lots of fluids, but also by using like a humidifier or the steam, so that it just sort of like loosens it all up, makes it easier to come out. Some people add eucalyptus oil to the diffuser or to the humidifier. That can be really helpful because it can help loosen it up and help it make it easier to expectorate. And also for some people and for some coughs, it can be a little irritating too. So I actually find that with a COVID cough, which is more of like a dry cough, it actually can be more irritating. So it can almost like trigger that cough reflex more so than not using eucalyptus. So I tend to just use regular water for like a drier, like for like that kind of irritated feeling cough. So you can, try that out in different ways. Also people sometimes apply it topically, like in a salve or something like that, and then they're basically inhaling it as well, and that's really good. I do not ever recommend taking eucalyptus oil internally. So I know that there's some resources out there that will say that, and I don't recommend it. It can have, it can make people like vomit, and it's pretty strong essential oil to be taking internally. Breathe Easy tea is a great one for those kind of like the tighter coughs where you feel like that kind of like tightness in your lungs. I'll mention later that if you're having like a lot of wheezing or coughing episodes that you can't catch your breath, those are reasons to seek medical attention, because a lot of times people will develop something that's it's like an asthma. Some people have asthma, and that's why they're experiencing those symptoms. And for some people, they actually experience something called a reactive airway disease, which is a response to the infection that actually basically, it's almost like they have asthma while they have the infection or after infection. Certain people just seem to tend towards that. So if any of those things are happening, definitely seek medical attention. If it's difficult to catch your breath, like definitely immediate medical attention. But the Breathe Easy tea is nice for when you just kind of feel that little bit of tightness. It's also really great to add honey to these teas so that you get the extra cough support by adding the honey. So that one is traditional medicinals. Throat coat tea is also really good. There's also another one called Throat Comfort by Yogi. So throat coat is traditional medicinals. Throat Comfort is by Yogi. And they're both really good. They're basically very similar in terms of the properties of them. So throat coat is more, it has this mucilaginous quality. So it basically means that these herbs form like a gel-like substance, and that gel-like substance kind of coats your throat and even has a little anti-inflammatory effect on your lungs, so that you, so if it's more of like that kind of like dry, irritated cough, then throat coat tea is definitely the way to go. So, whereas Breathe Easy is better for like a wet cough or that kind of like tightness in your lungs feeling, like when you feel like you can't really like breathe in very far. All right. So I think that's pretty much everything to say about coughs. Oh, there is an acupressure point called 1, which is right in your shoulder right here, like right right there, kind of like again, you just can find that tender spot that's like right in that little indentation right there, like under your collarbone. And sometimes that can be really helpful as well to just sort of open up your lungs. The fever, there's a lot of back and forth about fever. I actually like dove into this one and I was like, oh wow, it's even more sort of back and forth than I thought. So there's some really good studies showing that doing fever reduction does not improve outcomes. And specifically, they've done these studies in ICU situations. So kind of like the more extreme situations where we would see a bigger difference in outcomes. But there wasn't really a major difference in the outcomes in terms of showing, especially that it's not beneficial to reduce the fever. Sometimes it's just really, fever reduction is a comfort measure, really, is the way I think about it. High fevers can just be miserable, and sometimes you just need a break from it or to be able to sleep. But the way that I, generally think about fevers, and there isn't a whole lot of data to really back this up, but just in a general sense, your body is really amazing at fever is actually an incredible response. So basically what happens is these little pyrogens, which are things that basically trigger a fever. Either they can come from two places. They can come from the bacteria themselves, can create something that actually creates like a fever response, or your own immune system creates these little signals, and they go up to your hypothalamus. Pretty sure it's your hypothalamus that triggers it. Yeah, it is. Yeah. And so then your hypothalamus actually then triggers your body to change the set point of your temperature. So it actually just increases the temperature of your body. And that is super wild when you think about it. Your body just has this little switch that can be turned on. And once that gets turned on, it activates some of the parts of the immune system. So it kind of signals to your whole body all at once, basically like turning on a fire alarm, that your whole body, your immune system, it gets activated, and it's basically like a big signal to say like, everybody on deck. And then it also that actually the higher temperature can make it harder for those bacteria or viruses to really survive. And so it can kind of break down some of those things. It doesn't seem to have a major damaging effect on our own tissues. That's part of the whole debate, is whether or not the fever itself is damaging to our own tissues. And also then it kind of breaks down the viral proteins. One of the things, so just like little things about that, like that there's some studies talking about kids after fevers having pretty big developmental changes, or like developmental leaps, I guess is what they call them. And that's pretty wild, right? It's like, and then there's this other sort of like, something else that people talk about, which I don't really know how well this is like studied or verified or anything, is that, like the plaquing of the brain, that does happen, that fevers actually help to like reduce that. And another thing that I think about a little bit with fevers is that a lot of times when you have a fever, your glutathione, is kind of used up a little bit more. And then if we take Tylenol, it actually reduces glutathione even more. So that's kind of the drawback to taking Tylenol, is that then you get these very low levels of glutathione, which, there's different things about glutathione. It's basically, it kind of recycles things on that methylation pathway. And so it's kind of really an important part of your body system and ability to sort of process out, waste products or toxins and things like that. And so really, it's kind of not ideal time to have that, to have something that lowers glutathione even more. So, and there's even, all kinds of relationships between glutathione and different cognitive conditions as well. So yeah, it's a debated topic. I tend to say, if you can let the fever roll, go for it. There's no real risk of a fever. People actually are often more afraid of fevers than they need to be. So, in terms of like, neurological damage, like it takes, a fever has to be up to like 106 in order for it to cause neurological damage. And it's not like that's, it's not like that's stepwise. It's just like, no, once it hits that, then it's causing, but fevers don't you really get there very often, unless it's a really severe bacterial infection. And like it's very, very rare. And so, and even, some people, in terms of the concern about febrile seizures, they don't they're more often in kids. They don't seem to have any lasting effects. But still, once a fever starts getting up into like the 103, 104 range, sometimes that's a time that people feel like, okay, maybe we should bring it down a little bit. But really, but basically, I'm looking at this resource from Seattle Children's Hospital, and they say that normal fevers between 100 and 104 are good for sick children. So basically, it's okay for them to go up to 104. And then very specifically, they actually say 100, only temperatures above 108 can cause brain damage. I've heard 106 in other resources, but and also, so it says that pretty much that kind of temperature only happens when a child is like left in a car or when the air temperature is really high. So it's actually usually a response to them not being able to regulate their own temperature in a very hot environment. And so more so than from infection. I guess the one, that 105, 106 might be able to be a temperature that people would arrive at in an infection kind of situation, but it sounds like that really high brain damage kind of level is really only from these ambient temperatures being really, really high. So yeah, the kind of take home message there is we don't have to treat a fever. Also too, there's kind of some things that get, kind of passed around about fevers, about like, how if you should try to break a fever, and if it comes back, that's a bad thing. So if you take, say, an ibuprofen or a Tylenol, we definitely don't want to take aspirin when with fever, especially for kids, because you can create a whole other set of problems. So ibuprofen and Tylenol or sorry, I should say ibuprofen and acetaminophen are the two we kind of want to work with there, if we want to do that. So if you if it's okay to let the fever roll, that's great. If it does get up over 104, that would be a time to consider also seeking medical attention, if it's cruising above 104 for a period of time. But there's probably a lot, everything I've learned about the body is that there's lots of things that are doing things that we don't really understand what they're doing, like take the appendix, or we're realizing that like that's actually a really important reservoir of bacteria, that kind of like from one perspective we're like, I don't know if this is doing a whole lot, except for causing trouble, like something like a fever. But I've learned again and again that there's really nothing that happens in our body that's sort of it doesn't serve some function. Sometimes that function is it's serving it's counterproductive because it's trying to serve a function that isn't really needed at the time. And at the same time, something like a fever is very much a response to an infection, and I really think helpful in that way. So so really kind of that when to seek medical attention. So I just want to kind of sort of really highlight, if you're short of breath, wheezing, or coughing so much that you can't catch your breath, seek immediate medical attention. And sometimes that can even mean an ambulance ride if you're really, having trouble actually catching your breath or having difficulty walking to the car. So a lot of people now have pulse ox meter, so that's actually helpful too, that can, but know that if your hands are cold, you're going to get lower readings. So, and also I've seen people with their Apple Watch get lower readings, and it makes them very scared. But if you're able to, if you're getting these readings in like the low 90s, low 80 or up high 80s, but you're still able to like walk around and climb a flight of stairs, you can, for sure that is a false reading. But that's also another good tool to have around. And if you're vomiting into having diarrhea for so long and you just can't keep fluids down, and you notice that like, sometimes you start to see like, your skin gets a little bit sunken, or you pinch the back of your hand and it doesn't go down very fast. So it kind of stays up. Those are all signs that you're getting very dehydrated. And, it's good to seek attention at that point too. A lot of times IV fluids are necessary in that kind of a scenario. If you have a severe headache and then, pain with bending your neck forward like this, that, especially if it's like very painful to do that, or you can't do that, that could be meningitis. So that's a good reason to seek medical attention. If you kind of start getting better, after, like, you're like 7 days in, you start getting better, and then you suddenly get worse. This one doesn't apply to COVID, because very often people get worse around like day 7 to 10. I mean, it kind of does, because if it gets a lot worse, then we want to check in and see how things are going. But a lot of times, if that happens where it's getting better and then it gets worse suddenly, it's good to seek medical attention, because that's where a lot of times that secondary bacterial infection will come into play. So whether it's like a secondary, bacterial pneumonia, whether it's a bacterial sinus infection, those kinds of things. But that's a good reason to go and touch base with your doctor to see if it's, if further treatment is necessary. If you have really bad abdominal pain, of course, go to the ER. If you have like a deep cough that is painful, pneumonia really often has like, it hurts to breathe, and it's kind of this deeper cough. Even if you have any kind of severe cough, it's good to get checked out. As an adult, if your fever is over 103, that's a good, and it kind of stays there for a while, that's a good reason to get touch base with a medical provider. If your fever lasts for more than 3 days. So that's, sometimes that can be an indicator. Again, I've seen people with COVID have a fever for like 5 days, and it's absolutely related to the virus. So COVID kind of shifts the rules there a little bit. But it doesn't hurt, if you're on day 3 of your fever and you want to just sort of, give me a call and check in, we can kind of talk through, and I can sort of rule out, even through talking, whether or not there might be something else, or whether we need to get a chest x-ray, or whether we need to do an exam, and what we need to do to proceed there. If you're undergoing chemotherapy, taking immunosuppressive medications, or immunocompromised, and you have a fever, it's a good thing to get checked out right away, because for people who are in any of those situations, things can get very serious very fast. So here's my last little note here, is that like that idea, there's a lot of people who are like, oh, I never get sick. And that's not, so it's a tricky one, because I'm always like, oh, that's great. But at the same time, it's not so great. So it's not necessarily a good thing. So people who, are immunocompromised can sometimes never get sick, because their immune system, most of what we experience when we get sick is really our immune system response. And so if we have, insufficient immune response, we aren't going to feel sick. So we might get an infection, but not ever actually have symptoms of that infection. And it is really important, especially for particular viruses that can kind of like persist in the body, that we have an immune response, and we kind of, fight it, because if we don't, then that infection can become a little bit more chronic, or can become chronic. And same thing with, bacterial infections. We definitely need to be able to mount an immune response, and actually really, as we do that, that is, that is our immune system learning that virus, learning that bacteria, and then is able to fight it even more effectively the next time. And the immune response itself, an ideal immune response is one where we, again, like catch it right in this kind of area, nose, throat, and it doesn't really kind of like replicate and become a bigger infection. So that's the ideal. And that is something I notice, is when I'm taking the immune supplements that I use sometimes, like EHB, BioVeg, those things, that it does, kind of go away faster. So I'll get like a little sore throat, kind of feel a little sticky for, maybe like 12 hours, and then I'm just done and going along, and don't ever get fully sick, even when family members get sick and things like that. So yeah, kind of having those sort of like mild, sort of like, quick responses, that's pretty much a sign of a good immune response. But never getting sick, that doesn't necessarily mean a good thing. If you're a person who just doesn't have much exposure to other people, then that, that happens a lot, is that you can go a long time without getting sick. What was I just thinking about with that? Oh, some of the a lot of people in natural medicine and, sort of like the old school sort of way of thinking about, about the body and about the immune response is that the ability to launch a pretty big fever is actually a really good sign. And I actually really, I think that looking at everything clinically, I really do think that that's the case, is that I see people who, the people who do not have kind of like, more kind of medical conditions and people who have a stronger immune system, they actually will kind of have a higher fever very often. But here you can hear the hesitation and the awkwardness in my voice, and that's because it's like not always in everything. So many things in medicine, everything in life is really a gray area where we can't really say it like 100% one or the other. But I also think that even just in the moment when if you're having a high fever and you're sick, it feels better to just be able to say like, oh, this is a good thing. So there's that too. That's I think that having a strong immune response is really necessary, but then we have it's a little bit complicated, because then we want to think about how to make it shorter and less intense to get sick, and also can we do that and still have an effective immune response, is something that we need to is kind of an interesting middle ground there. So all of that to say, we all are going to get sick. It's part of being a human, being alive, being a living creature. I hope that some of these things can give you some relief if you do get sick. And also feel free to reach out if you do get sick and want to have sort of advice that's more specific to your situation. And of course, if you're having any symptom that's like especially concerning to you, or that you've never had before, or that I didn't list on the reasons to seek medical attention, definitely contact me or your provider, and touch base, or come in for a visit. All righty. Well, I hope that everyone stays as healthy as possible and has quick illnesses if you're going to have any this winter. And I will see you all next week.